Well, good evening, everybody, and thank you so much for joining us tonight. We are so excited to be spending the next hour or so with you discussing something that we're very passionate about, frozen donor eggs. Our hope for you tonight is that at the end of this discussion, that you receive some valuable information and feel ready to engage in the next steps to building your future family. My name is Becca Murillo, and I'm an IVF nurse. And I worked in an IVF clinic for 11 years and recently joined Donor Egg Bank USA as a physician relations manager. As an IVF nurse, I talked with hundreds of families about donor egg IVF, and I'm honored to speak with you tonight about what it means to use donor eggs. Let me introduce to you Donor Egg Bank USA's co-founder and executive vice president, Heidi Hayes.
I just want to say hello, and it's such a pleasure to have everybody with us tonight. I hope you're going to love the information we will be sharing, and at the end, we're going to answer your questions. So you will see a little question and answer Q&A. That's where you'll put your questions, and we'll answer them at the end of the presentation versus putting them in the chat. So put them in the Q&A, please. Go ahead, Becca.
All right, let's get started. So our objectives this evening include coming to terms with the diagnosis. And for many, this is the hardest part. Some of you may have known that your best success would be that of using donor eggs. And so you've known maybe for a while that this would be your best option. Some of you may have just found out, last month or even last week. And so your emotions are running high. You're not sure how you feel, and that's okay. However you feel right now and wherever you are in your journey is completely okay. Some of you might be excited and ready to hit the ground running, while others may feel unsure or sad. I just encourage you to talk about this with your partner, with your physician. Ask those questions so that you have those answers and you can feel confident about moving forward in the process. I also want to say, if your clinic has a wellness coach or a counselor, think about reaching out to them and using them as a resource to navigate these emotions that you have and face these common fears. So what are the next steps in this process? How do you take them? How do you choose a donor? We're going to talk about that tonight. We're also going to map out the financial plans. So what are they? How much does it cost? How much is it going to take, and how long is it going to take me? So here we go. We're going to look at the future here.
So I want to start out with just sharing a little bit about me and how I came to Donor Egg Bank USA, because like many of you out there, I've actually walked down this path. So my husband and I, we were in our early 30s thinking that we were going to get pregnant so easily. And by age 34, we had given up hope on IVF. We went through nearly 11 cycles of IVF and multiple miscarries. We were told to be cautiously optimistic it would work, but we never got to the point of seeing a heartbeat. And we couldn't figure out why. I really felt there was something wrong with me. Go ahead, Becca.
Sorry.
So we decided to move forward with an adoption. So given that I thought something's wrong with me, I probably can't carry a baby, let's just move forward with the thing that's going to work. And so we decided to do an adoption. And we went to Guatemala, and you see us here at the airport coming home. We were the happiest people in the world. We finally had a baby. But I knew pretty quickly that I didn't feel complete. I wanted more than one child. I wanted at least 2 children. Optimistically, I wanted a boy and a girl. And so here we are with a photo of our daughter, who would also come from Guatemala. It worked for us once. Why not go back a second time? So we tracked that adoption. We went and visited her and held her. Actually, this picture, I think this is her 9-month picture. We were there for her year birthday, and we were so happy. I felt so complete for the first time in my life. And then tragedy hit. We followed this adoption for 6 years. And this picture that you're looking at is particularly poignant for me because it is the last time I ever saw her. It was devastating. And if you're out there and you're anything like me and you've had a miscarry, you know how painful that is. Nothing compares to putting this baby in your arms and calling her your own and knowing that you may never see her again. So it really put us at that point of what do we do? My gosh, at this point, we failed IUI, we failed IVF, we failed adoption. I mean, I felt like a failure from top to bottom, and I didn't think anything would work for me. But I also knew that I wanted another child. Sometimes I tell people like I saw the world as like black and white and gray. It was not vibrant to me because there was a part of me inside that was like dead. And so we started to look at our options, and we really weighed adoption and egg donation. We'd been told about egg donation, but I didn't think that I could carry a baby, so we didn't pursue it at the time we were told. So once we investigated it, what I identified is the costs were about the same. If anything, the adoption costs were more. And it added up, you know, all the home studies and fingerprints and legal fees and readoptions. It's pricey. I found out that 10 to 20% of adoptions actually fail. Birth mothers do change their mind. And I wasn't alone in the fact of having an adoption that did not go through. In the adoption process, we spent a lot of time waiting, and we had no control over the process, nor did we have any choice. You know, once you're presented with a child, you're told that, you know, you can take that referral or you can pass. But if you pass, who knows how long it'll be before you get another referral. So you just say yes, and you're just happy with your first choice. But with egg donation, I would be able to get on and actually look at the donors, and we would be in the driver's seat. And then we would move as fast as we wanted to move with that donation cycle. With the wait time, you know, it's typically, you know, the 2-week wait to know if it's going to be successful. And then you're just waiting for that clinical pregnancy. My wait time for that last adoption was 6 years before we knew it would fail. And with my first child, several years. With the adoption, my son obviously was carried by his birth mother. But with the egg donation, I would get that chance to be pregnant and to be the biological mother. I might not be the genetic source for my children's DNA through egg donation, but I would be able to have that biological connection of the pregnancy, and my husband would be able to provide the sperm so that we could both have a connection. And then it was also really appealing with egg donation to know that we could bond with the baby in utero. I wouldn't be paper pregnant. I wouldn't be looking at photos, wondering how that baby would be. And we would also be able to be with that baby at both the delivery and immediately after. So we saw a lot of benefits to egg donation. Becca, why don't you cover some of the reasons for egg donation?
Sure. So some of the reasons for egg donation include decreased ovarian function. So this is the decrease in the quantity or the quality of your eggs. Premature ovarian failure. This is the reduced function of the ovaries under the age of 40. And sometimes that is caused by genetic factors or maybe autoimmune disorders, genetic abnormalities. Maybe there's a family history of genetic diseases, failure of other treatments. Many of you maybe have gone through multiple fertility treatments without success, or maybe you have gotten pregnant but suffered a pregnancy loss. And donor egg bank is all encompassing of our LGBTQ plus community. So why donor eggs work? Women are born with all the eggs we're ever going to have. And as we age, our ovarian reserve diminishes. Our peak fertility is actually about between 20 and 30 years of age. And we see a rapid decline starting right around 30 years. And as you saw in that last slide, there was a downward trend. And in this slide, you'll see this upward rise. And this graph indicates that as we become less young, the miscarriage rate increases. And we know that most miscarriages occur because of chromosomally abnormal pregnancies. So what are some of the advantages of using frozen donor eggs versus a fresh donor cycle? So you would receive 5 to 8 mature eggs, and these eggs are already frozen and they're ready to go. And the reason we have a range here is because every woman provides mature eggs at different numbers. So we use an algorithm to ensure that we're using only the best mature eggs. And when you look at the donor online, you'll be able to see how many eggs are under her profile. So you'll know exactly how many eggs you will be receiving. There's no need for synchronization. So we're not having to prepare your uterus with the donor's ovaries. So there's none of that synchronization that has to happen. These eggs are already retrieved and frozen. You don't have to worry about your donor dropping out, maybe not taking her medication as she should. And also we have a wide variety of donors available, over 300 plus donors for our US and Canada patients. And you get to control the cycle timing. So you're cycling when it's convenient for you. This is also a great option if you're using a gestational carrier or surrogate. And frozen donor eggs are less expensive than a fresh donor cycle.
I love to share about Marsha Cross. Many of you might remember her from Desperate Housewives. But Marsha Cross to me is such an inspiration. And it's because she's one of the very few people in Hollywood who has publicly said that she used a donor. And I like the way she puts it. She says, I don't like the average woman being misled into thinking that fertility is something that goes on forever. When a woman gets older, they get donor eggs, which doesn't make the baby any less beautiful or perfect. One's own eggs only last so long. I think we are often, misguided when we look at Hollywood and we see these women and they're, 45, 50 years old and they're having their children and it was so effortless and easy. No one requires them to say that they use donor egg. That's their own private business, just like it would be your own private business if you use donor egg. But let's, be reasonable here and know that many of those women in Hollywood are utilizing donor egg, and it doesn't make their baby any less beautiful or any less perfect. So let's discuss the success rates, because I really think that this is the reason why my husband and I were attracted to donor egg. There's an emotional cost to every cycle you do. And when you go into treatment, if you've had prior IVF treatment, they talk to you about the financial cost, but not everyone talks to you about the emotional cost. So you want to move forward with something that's going to be very likely to work. So we are very transparent with our data. We expect our 2020 data to be published probably by the end of the month. But for right now, we'll take a look at the 2019 data. We had over 500 transfers that were performed. Actually, it was more. This is only half of the 2019 data. Let's look at 2018 and 2019 together, so we have a more accurate picture. So between the two of them, we're looking at 1,700 transfers. Approximately 6.8 eggs being provided to the recipient. So as Becca said, there's anywhere between 5 and 8 eggs in an egg batch. We try to optimize around 6 or 7. So that's why you see that 6.8 overall. The pregnancy rate of 69%. And this is just getting that positive pregnancy result. The clinical pregnancy rate is 60%. And that clinical pregnancy rate is seeing a gestational sac, a baby with a heartbeat on the sonogram when you go in. So this is getting to that heartbeat stage. Women and men that moved forward had on average 65% of the time extra embryos to go ahead and freeze for possibly baby number 2 or even another try. But it's very natural that there is a miscarry rate, even with donor egg. I think that's just part of being human. And that miscarry rate is averaging around 15% all time, which then results in an ongoing and a live birth rate between 49 and 52% per transfer. And per initiated start or just an attempt, it's 44 to 45%. So the statistics are good, and it can give you confidence moving forward with a donor egg treatment.
So let's talk about choosing a donor. First, I just want to say that our website is available 24/7. So you're able to log in and create an account for free. But let's talk a little bit about the donors. Our donor database, like I said before, has over 300 donors. And these young ladies go through extensive testing and screening to become a donor. For every 100 application that comes in, only 1 to 2 of these young ladies will actually make it to retrieval. So this gives you an idea of the thorough screening that they go through, as well as the dedication to make it to that retrieval. Some of the things that clinicians look for in a donor will review the genetic screening and testing, a multi-generational family history, their medical history, their fertility health. Donors have to be non-smokers. They do go through drug screening, extensive infectious disease screening, and they are seen by a mental health specialist for screening and counseling.
So what are some of the tips for selecting a donor? Having been through the process, I wanted to share just some thoughts here. First of all, enjoy the process. So make this an exciting time. If you have a baby through donor egg and through your try, you're going to want to tell your children one day how excited you were to find this donor. So my husband and I, we cracked open a bottle of wine, believe it or not, we drank the whole thing. And we really enjoyed the whole database. I mean, we looked at all different kinds of donors, and it was a lot of fun. Like I said, I think having gone through so many attempts and being out of control, it felt nice to be like in the driver's seat for the first time. So you can expect to match the most important issues that you want in a donor. But remember, there's no perfect mini you out there. You are perfect and wonderfully made, and there isn't another individual exactly like you. You'll have to make some compromises on some of the less important issues. For example, if it's really important to you that the donor is tall, you might have to compromise, and maybe you're going to get a tall donor, but maybe she isn't an avid volleyball player like you are. Look for her intellectual potential and not just her education level. You know, we are bringing in donors in their early 20s for a first-time donation, and many of them haven't, you know, had an opportunity to go back and get that master's degree, or perhaps they finished high school and they want to work a couple years before they move forward in getting their formal education. When we do have some donors actually in their early 30s, these are donors that have donated before, they have a track record, they're fertile, and we go ahead and we invite them back up through age 32 to 33. But first-time donors up through age 28. Remember that everyone has imperfections, including the donor, as well as you. And I just want to say that it's not that important to match the blood type unless you don't intend to tell your children that you utilized a donor. But I just want to make caution there, because in today's day and age in which we have 23andMe and Ancestry.com and all these donor, DNA banks, there is a great likelihood that one day your child would discover this, perhaps accidentally. So it is considered, a best practice to start telling children when they're young that they were donor conceived. And like I said before about the Hollywood stars, you can be private about it. You don't have to tell, everyone. I recommend you tell the pediatrician so that they can provide good medical care. But you might want to tell your children that they're aware of this. And then one more thing before you move on, Becca. I really wanted, when I looked at a donor, to match what I thought were some of my weaknesses. So don't just look for the strengths. Consider your own imperfections and weaknesses. I don't sing very well. And so when we looked for a donor, we really wanted a donor that had some singing talent. My husband doesn't sing well either. And so we did choose a donor that loved to sing. Well, I actually have a daughter that loves to sing. She thinks that she wants to be an opera singer one day. But it is fun to see those strengths in children that are weaknesses in ourselves.
Those are great tips, Heidi. Thank you for sharing. So let's talk about financial plans. Our single egg lot plan, you will receive 5 to 8 mature eggs, and the cost for this plan is $14,500 US. And this guarantees at least 1 or more blastocyst embryos. We also offer a double egg lot plan where you will receive 2 egg lots. This plan does provide a discount off the egg lots and guarantees 2 or more blastocysts within that combined set of eggs. And while we're not huge proponents of PGTA with donor eggs, if it is something that you and your physician wish to perform, we do have a euploid quality guarantee rider that can be purchased separately with our either our single cycle or our double egg lot plan. And this guarantees 1 or more euploid embryos with up to 3 egg lots. So let's move into our single cycle plan. And this plan is where we combine the cost of the eggs with the treatment. So we'll work with your physician to decrease the cost of the eggs and the cost of the treatment and come up with a one-time upfront cost that's more reasonable for you. And another benefit to this plan is that both the eggs and the treatment are both protected. And what I mean by that is if for some reason the egg lot did not perform well, maybe fertilization didn't occur, and the cycle was canceled, you might have to, you would maybe, if you were in a single egg lot or a double egg lot, the clinic might have you pay for that additional treatment cycle. But with this plan, you would be protected and the treatment is guaranteed. The cost of this plan varies amongst the fertility clinics because every physician has different pricing, But if you contact us, we'll be happy to let you know what the cost is for this plan. Assured Refund Plan. This is our most popular plan and a personal favorite of mine. When I worked in the IVF clinic, I have to say that there was a sigh of relief when my patients were enrolled in this program. The reason for this is I knew that they were going to have multiple tries and that Donor Egg Bank USA would be carrying the financial risk. The Assured Refund Plan provides you with a safety net that if you don't come home with a baby, that you will receive 100% of your money back. This plan offers up to 6 treatment cycles with, or 6 egg lots with unlimited frozen embryo transfers. So not only does this plan protect you while you're going through treatment, but it also protects you against miscarriages or late pregnancy loss. You do need to qualify for this program, but I'll tell you it's a simple process. We'll work with your clinic to obtain your medical history, and 95% of patients that apply for this program do qualify, and 92% will bring home a baby. I also want to mention that should you choose to withdraw from this program, you will receive 50% of your money back.
So Becca, let me just add before you move on, just pop back one more, because I want to help people get their head around it, about the Assured Refund Plan. Like Becca already said, call us. We can give you the pricing for your fertility practice. What we've done is we've bundled the cost of the eggs, we've bundled it with the treatment, and then we've actually reduced the cost of the eggs and the treatment together to make it more affordable, and everything is guaranteed. But if you take the Assured Refund Plan and you get pregnant on the first try and you take that baby all the way to a delivery and bring the baby home from the hospital, you will pay too much. I like to tell people, jump up and down and scream hallelujah that you didn't have to hear from the doctor 6 times to say, oh, I'm sorry, it didn't work. Because if you're anything like me, that was a whole day in bed and it took a lot to pull myself up by the bootstraps just to move forward. But for those that need 2, 3, 4, 5, or 6 tries, you're going to pay way too little. And if you take home, if you don't bring home a baby, we're going to give you your money back. So it keeps you financially whole. But I just want you to be eyes wide open. If you get it on the very first try, you've paid too much. But think to yourself how wonderful it is that you've actually subsidized the payment of what it's going to take for some people that are 5 or 6 cycles. So many cycles, you pay way too little. First cycle, you pay a little bit too much. That's how the plan works. And that's why it's a financial safety net for everyone involved.
We did find that some physicians like to keep the eggs and the treatment separate, and also that some patients had insurance that covered the cost of treatment. And we wanted to be able to offer the live birth guarantee to patients that had this coverage. And so we came up with the multi-egg lot refund plan. And in this plan, it's very similar to Assured Refund with a couple of key differences. You will receive up to 4 egg lots and have that guarantee of a baby, that live birth guarantee. Cost is separate for treatment. So the treatment will be paid straight to the clinic. The cost for this plan is $30,000. And which is really the cost of 2 egg lots. But with this plan, you get the live birth guarantee and a full refund if you don't bring home a baby. And similar to the Assured Refund, you do need to qualify for this plan. And should you withdraw from the program, you will receive 50% of your money back.
So let me just mention about free cord blood and tissue processing. And I know we're getting ahead of ourselves. I mean, we haven't had the baby yet, right? But I just want to put it in the back of your head, because one of the things that we feel so strongly about is if you go through egg donation to save your newborn stem cells, and have those for the future. I wish I had done this. We provide this to you for free. If you utilize Donor Egg Bank USA or our sister company, which happens to be a sperm bank, California Cryobank, then we will provide you free cord blood processing and the first year of storage free. And that's just a wonderful thing to really protect that investment in your newborn. And one more thing, it's so exciting. The number of regenerative studies that are happening is really phenomenal. And I think, 20 or 30 years from now, hopefully we'll be utilizing newborn stem cells to cure cancer and so many other things. So it's really cool to see where science is taking us. So let me just summarize. Here are some of the fears I had when I came into the process. First of all, will I love this baby? I think that was my number one fear. But, I found out that I loved my adopted son just fine. And I knew that my husband would have a genetic connection, and I knew I'd be able to bond with this baby in utero. And what I've learned from just talking with, so many men and women, yes, you will love this baby. I saw a quick Q&A come in which somebody asked in the Q&A, what is the likelihood you won't bond with the baby? I'm not going to say it has never happened. I am aware of one case. But, we've done, over 9,000 cycles, and I only know of one case. And everyone else I talk to loves their baby, just like Marsha Cross said. Beautiful, perfect baby. Can I even carry a baby or be successful? When it really came down to it, it wasn't my uterus. I really thought it was, but it was really my eggs. I wasn't successful because my eggs weren't successful. So nearly everyone can carry a baby. Will everyone know I used an egg donor? Not if you don't tell them. You can choose who you tell. If you choose an egg donor that looks a little like you, that might help. But there's no guarantee that even if your partner provides their sperm, that the baby will look anything like your partner. Can you emotionally and physically do another cycle? If you're feeling like you're toward the end of what you emotionally can do, I really encourage you to make the jump to donor egg. Make sure you've grieved that process. Possibly do a last cycle if you need the closure, but don't wait too long. There is a point where you emotionally can't do anymore, and make sure you make this decision before you reach that point. Will you find a donor you like? We have more than 300 donors on our database. We typically hover around 350. So you should be able to find a donor you like. And if you don't see a donor that you want, sometimes we find this with, for example, Middle Eastern donors are hard to find, Indian, Asian. Let your case manager know. Your case manager will be able to help you find a donor that will either work for you or put you on the wish list in case one of those donors comes through. And then lastly, can I afford it? Like Becca said, we've got great financial plans, from just a single egg lot to some of our bundled plans. Our single cycle plan and our assured refund plan give you guarantees on both the treatment as well as the eggs to make it the most affordable package available and protect you from the financial risk. So we really encourage you to look into those. But we have so many plans, we can cover nearly every situation. So Becca flashed up, a picture of me. You probably already know I went through donor egg treatment. I really only wanted one more child. And so when we got to the point where we had to make a decision, we took a look at the embryos. I was told that they were, polar body wasn't in the right place. They were kind of crappy looking, and I wasn't given much hope. So we put them both back, and I ended up with two wonderful, beautiful children that I'm so happy about. Let you flip it to the next one. And so here are my children as they're getting a little older. There is my budding opera singer in the middle. And I like to just tell people that we each have our own journey. Your journey is going to be different than my journey. But really what binds us together is that deep desire to be a parent and our willingness to persevere to make our dreams come true. And I will tell you that once my two children were born, I felt complete. And the world was like Technicolor. If you remember, I said it was like gray, black, and white. I saw colors on my normal drive to work, flowers that I had never seen before. And there was something about the completeness that I felt that made me really passionate about donor egg as a great option. And I hope you will find it will be a good option for you as well. So I want to thank everyone for joining us tonight. We're now going to go into questions and answers. Becca and I will both do those with you. We do have case managers available tonight. When you call us, what we'll do is we'll enroll you. We'll take your basic information. We'll give you the access to be able to choose a donor anytime, day or night, 24/7. The database is active. If you see a donor you like, just match with her. You can always call us the next day and say, oh my gosh, I think we were a little premature. Can you cancel it? But the donors, are popular, and you might find the perfect donor, but if you wait too long, you're going to be challenged that she will have already been taken. So here's our email address as well. Email us, call us. We'll give you the financial guide for your fertility practice. That will tell you exactly how much that single cycle costs, as well as the assured refund plan. Let's go ahead and get started with the Q&A.
So we have a question asking about the COVID vaccine and if they're going through IVF, if it's safe. And there has been some guidance from ASRM, which is American Society of Reproductive Medicine. And they are recommending to get the COVID vaccine, that there aren't studies that show that there are reasons not to. So I would talk with your provider, but from what we've read and what we've seen come out, the publications, that it is recommended.
I saw a quick question come through the chat, and Becca, I want to answer it because I want to clear up everything. So for myself, I went through donor egg treatment before we were freezing donor eggs. I actually did a fresh cycle. I had 9 eggs and, 2 not great looking embryos. So all 9 of my eggs fertilized. My embryos they didn't do well. I don't know why, but obviously they did great because I ended up with 2 children, right? So what happened in 2013 is we were already doing so much freezing of eggs that we found out that we could do it very successfully. And in 2013, the experimental label was removed. You've probably heard about the boom in social egg freezing and women coming in to, cocktail parties to freeze their eggs. That is all because of frozen donor egg. We were the first doing it. There are some other egg banks as well doing it, but we were able to provide the track record that we can do it very successfully, very safely, and with great results.
Okay. Let's see. We have some people are asking for particular clinics that we work with, and we would be happy to talk with you about your clinic. If it's not a clinic that we currently ship to now, we can, and that is something that we will do, is talk with your clinic and get that all figured out for you.
I do see a question here of somebody in Australia, and we will be have donors ready for the Australia market within a few months. So hang in there. We're looking forward to that, but we're not ready to launch quite yet.
The pregnancy rate is per transfer or per egg lot, and it's per transfer.
Someone is asking, how many embryos can be transferred per cycle. That's really a decision between you and your doctor. We don't get involved in that, but we are major proponents of a single embryo transfer. The goal is for you to bring home a baby, and the safest way to do that is one embryo at a time. Let me quickly just state, I see some questions regarding the pregnancy rates. The pregnancy rates are on our website, so at any time you can go back and take a look at that. But currently, the opportunity for a clinical pregnancy, meaning you transfer one embryo and you go into the doctor's office and they actually see the heartbeat on sonogram, is 60%. So you have a 60% likelihood you're going to see the heartbeat.
We have a question about, are there donor notes for successful donors who have been invited back? And we do have many donors that have gone through multiple retrievals with us. And we can, if that's something that if you're wanting to know about previous success, we are able to provide many donors that come back and are successful.
I saw that somebody asked about they were registered on the website. I would recommend that you contact us. There could be, you're seeing most of the donors, if not all of the donors available. It does vary slightly by jurisdiction as to where you live, just because of licensure reasons. But contact the office, because what they'll do is they will grant you full access where you can see the donor's fertility. You'll be able to see her genetics and her medical history. You'll be able to see a little bit more than you do when you just register. And we really do that for the privacy of the donor, just to, keep some of that more personal information locked down.
We have a question about, with regards to the assured refund plan, if you choose not to use all 6 and only use 1 or 2 tries, will I be fully reimbursed? So with the assured refund program, that's up to 6 egg lots. If you get to all 6 and you don't bring home a baby, you would be refunded 100%. If we withdraw you from the program, so if after multiple tries we don't feel that we can be successful in this and we withdraw you, you would receive 100% of your money back. If you withdraw on your own, even if you've gone through 1 or 2 tries, you would receive 50% of your money back.
And let me just piggyback onto that and say, those are 6 egg lots, but also all of the frozen embryo transfer cycles are included too. So when you do the assured refund plan, you make your payment once, and then you sit back and you relax and you just say, I'm just going to now be stress-free and we're just going to go after this until we have a baby. And 92% of people will bring that baby home. So I think it really takes a lot of the pressure off of treatment. The assured refund plan, from time to time we get asked this, it does not cover the pregnancy test or the OB sonogram, because at those points, typically your pregnancy and your insurance will kick in.
We have, what is the name of the plan, which we just discussed, which was the 30,000. So that's called the multi-egg lot refund plan. And then we have a question asking about the difference between the two, the multi-egg lot refund plan and the assured refund plan. And the difference, the assured refund plan offers you the most protection because it's the eggs and the treatment combined together with up to 6 egg lots. The key difference is with the multi-egg lot refund plan, the cost is $30,000. It's up to 4 egg lots. The treatment is paid separately to the clinic.
Okay, so I'm going to answer this one. I'm going to actually read it because I think it could speak to some of the fears that many people have. How do I get over feelings of giving up my body to have my husband's and a stranger's baby? It feels unfair, and this is holding me back. I heard women say they feel left out because the baby does not look like them, and family comments on how the baby looks like daddy, but not them. I'm worried about this and can't seem to get past this feeling of concern. So first of all, let's talk about this. You mentioned a stranger's baby. The stranger is not having a baby. The stranger is giving you one cell. You have to look at it under a microscope to even see it. And it is a special cell, but it is one little itty bitty cell. And it's really your body or your gestational carrier's body that's going to weave that baby into that baby. I would tell people to choose a donor that looks a little like them. I'm going to be honest, I didn't do that. I didn't choose a donor that looked anything like me. I actually chose a donor that looked a little like my husband, who's Hispanic, because I really wanted my adopted son, who's from Guatemala, to have a sibling that looked like him. But the funny thing is, I don't know if you can flip the slide back and go back to my family.
Mm-hmm.
What I want to point out is that my 2 children that are donor conceived ultimately looked more like me than they did my husband or my son. And we designed it for them to look like them. So there's no guarantees in life at all. The other thing that I find really comical is that how many people forget we use donor egg. I can tell you that my mother has more than once said, oh, well, she gets that curly hair. She must get it from my mother. And I'm like, well, she doesn't get it from your mother because she's not genetically related to you. But, people forget, even your closest family members forget because this child becomes your baby. This is the baby that you hold in your arms when they scream at night. You're the one that's going to pick them up and take care of them. When they take their first step, you're the one holding them doing that. Every part of that baby will be your baby because you carried the baby, you held the baby, you took care of the baby. So I wouldn't worry personally about this concern. It's only one cell.
Okay. You just take a quick look.
Somebody is asking, in the multiple lot bundle, such as assured refund, do they all come from the same donor? It's unlikely. To move through the assured refund plan or the multi-egg lot refund plan, you have to be open to taking different donors. And what you'll find when you're unsuccessful with a donor, most people, not all, but most people would like to try a different donor anyway. They don't feel successful with that donor. They'd like to try somebody new.
We have someone said that I found that the donors don't have that many Asian profiles. And I will tell you that this changes on a daily basis. So I would continue to look. And as quickly as donors come up, they come down. So if you find a donor that you really like, I would go ahead and place them on hold and talk with the case manager so that you can guarantee that you have that match. And we continue to update our website regularly so that we can offer more profiles to you.
Oh, we have several questions regarding the cost and the pricing and the differences between the egg lots. We will be sharing this presentation out. You can actually watch that yourself. Again, give us a call, email us at the info@donoreggbankusa.com. and we'll send you the financial guide. You'll be able to read in the financial guide the differences between each of the offerings, as well as the exact cost for your fertility clinic. When you go with the treatment with the egg lots kind of bundled together, you're going to see that it is sometimes only a couple $1,000s more than just buying a single egg lot, and that includes all the treatment. So definitely you're going to want to review what your fertility clinic offers at their clinic.
We have a couple of questions about qualifications for the assured refund plan. And, what we're looking there, we're really just trying to see what your medical history has been, what type of cycles or fertility treatments you've done in the past. Take a look at the uterus, take a look at the fallopian tubes. So just trying to get a good idea of what your past medical history is. And the sperm source too, we take a look at that. And our medical reviewer will review all that information.
I'm going to tackle two of these questions, Becca. One is, what is the age limit going through an egg donor? That is dependent upon your fertility practice. Many fertility practices limit anywhere between like 50 and 55 years of age. And then the second question is how to figure out the intellectual potential of the donor. What are key words to look for in the process? The potential, I think, is important. You can usually see potential when you look at, how did they rate themselves? Like, did they love math? Did they love science? Take a look at their motivational statements. How much do they write? How accurate is the grammar? What is their passion? Sometimes they'll talk about the different clubs they've done or different types of volunteer service. So if that is the most important thing to you, then, really look for it within the whole profile. But you'll find it interesting that that's not important to everyone. We've actually had some people that have said that, how pretty the donor is the most important thing to them. And if the donor had any challenges, they can, utilize a tutor or provide, special schooling. So everyone is a little bit different in this process and what's important to them.
We have a question about chances of multiples. I feel like now a lot of clinics are choosing to put back a single embryo transfer, especially with donor embryos. And so when you place back two, really that's increasing your chance of multiples at that point. So it really is dependent on how many embryos you transfer. Heidi, do you have any more insight as far as if we have statistics on that?
Our multiple rate is very, very minimal. I want to say it's like less than 5%. Because most people do put back just one embryo, but there are times in which that one embryo also splits and you will have multiples. Believe it or not, I just have to share. We had in one of our Canadian clinics, one embryo put back and they had triplets.
Where
and
one split
like and 1 in 13 million chance. I want to tackle this question about why are some of the European clinics, why do they cost less when they have fresh eggs and good success rates? That's an excellent question. Sometimes they cost less because they don't do the same level of screening. But what you'll find in many of the European clinics is they'll have anonymous egg donation. For example, if you go to Spain, they will literally choose the donor for you. You don't get to choose. They're often very anonymous. You might not get any photos. But what I find the most concerning about people that go abroad is they don't get the level of medical history or information on the donor. Don't be short-sighted. This is when you have a child, and for example, after I gave birth, my son had problems with his eyesight. The first thing my doctor asked me was, tell me about my eyesight. Frankly, my eyesight's not important. What's important is the donor's eyesight, right? But I had all those medical records to be able to share with the doctor so that we could troubleshoot it really well. And now my children are at an age that they're starting to have questions about the egg donor. And I'm able to say the egg donor was a nurse. You know, she's probably a first responder during COVID. Like, what an amazing woman this is. Like, I want to build up their self-esteem with this great information. And there will be a day that they'll see the pictures of her, that they'll have that identity of who they are. So you may be at a point in the process that you don't really care. You only want to get pregnant. But I'm telling you, you got to think beyond it and think about being a parent and what that means and what type of information do you want about your child and your child's family long term. As well as also think about genetic screening. You get one shot at having this information, and it's when you decide to source the donor eggs and who you get them from.
We have a question about what type of financing options are available. We do have several companies that we work with for financing, CapEx, MD, Future Family, and is there one more, Heidi? I think maybe I'm missing.
We work with, CapEx, MD, Future Family, ARC, Carrot.
Okay.
Yeah, multiple programs.
And our case managers can also guide you with that information as well.
Medicard up in Canada as well. Somebody has asked about Indian donors. You've discovered they are very hard to find. We are working on some different options. Go ahead and give us a call. We're starting a wish list for a program that we're hoping to pull together that will provide greater source. We also have, and I know you don't want to hear this, but you know, many Hispanic donors that we have that look like Indian donors because we culturally, you know, these are not women that tend to go through egg donation. It's just not, doesn't culturally fit for them, but it doesn't mean that you don't have a right to be a parent. And it doesn't mean that you don't have a right to have a baby that looks as much like you as possible. So we will work with you the best we can to try to get the right match for you. Is it possible to breastfeed a donor conceived baby? Absolutely. I breastfed my children for 2 full years. Call me crazy, but I did. 2 full years, twins. Remember, you're the one pregnant, so your body is going to act like any other body. I mean, your body doesn't know that genetic one little itty bitty cell that was microscopic came from a donor. Your body has no idea.
There's a question about someone had enrolled and just ready to talk with a case manager. So they will be gathering your information and be reaching out to you very shortly to help guide you on next steps.
How common and real is it for mothers to have trouble bonding with a donor conceived baby? Like I said, I know of one case that I'm aware of. I think that was also a situation in which there was a divorce occurring, which I think compounded the problem. But this is extremely, extremely rare. We do have some women that have gone through the process. Again, if you let us know, we might be able to connect you with somebody that would also be willing to talk to you. And I would also recommend that you talk with your fertility practice and speak with the psychologist there. And utilize them for your benefit and get their statistics as well.
We have a question about, are we required to donate our cord blood, and what if we want to keep it for our baby? And the cord blood, that is for your baby. So if you choose to process that cord blood and store it, that is for you, that's for your baby. It's all for you.
We want you to keep it. So
yes.
Don't donate it. Please keep your cord blood for your baby. Does the 100% assured refund plan and multi-egg lot refund plan apply to implantation of twins? Yes. If you and your doctor agree to put back 2 embryos, absolutely. Once you actually deliver a baby, any remaining embryos are yours. What criteria disqualifies you from the assured refund plan? Becca, why don't you answer that one?
Disqualifies?
Yeah, disqualifies.
So if you've heard the word hydrosalpinx, that's an inflammation or infection of the tube. That is something, if it hasn't been treated, that would disqualify you. We're also going to take a look at the uterus. We want to just see if there's been any previous surgeries. The medical reviewer will look at surgery op reports, take a look at any fibroids that you might have. If you have recurrent pregnancy loss, we'll take a look at that and just see if there's some clue as to what may have caused that. Sperm requirements, we want to see 1 million total motile count of sperm. And I'm trying to think of the other major ones, but those are kind of the big hitters. But overall, we'll take a good look at your medical history and then your past, any past fertility treatments that you've done.
There's several questions here about the multi-egg lot refund plan that is $30,000. I think the questions are because that's one of the plans we actually told you the price. I highly recommend contact us, because if your program offers the assured refund plan, you may find out that it is not much more than the $30,000, and that will give you the actual guarantee over all those treatment costs, as well as that 100% refund and up to 6 egg lots and all the frozen embryo transfers included, which is a far better value than the multi-egg lot refund plan at $30,000. Here's one that has adenomyosis, Becca?
Adenomyosis.
Yeah. Do you want to answer that one? They're concerned that egg donor might not work for them.
So adenomyosis, there is some treatment that physicians will take in order to prepare the uterus for successful pregnancy. I'm not sure the extent of treatment that you've gone through, but in my previous job at an IVF clinic as a nurse there, I did have several patients that were successful. So I would say consult with your physician, keep your head up, and know that we're here to support you as well.
Can you meet the donor? We do have donors that are ID release, but you may not meet the donor. The goal is for your donor conceived offspring, or your child, to one day have access to the donor. Someone's asking that they're in Canada and is COVID a concern because the borders are closed. Not a problem. We ship into Canada nearly every day. And we work with most of the fertility practices in Canada. It's highly likely we work with your program. And I should just say to everyone on the phone, we work with more than 280 fertility practices. But if we don't work with your fertility practice, just, let us know. We'll reach out to your doctor. We'll get them set up. It's a pretty simple process in order for you to move forward.
We have a question. Why would someone withdraw from the plan? This doesn't happen often. And if it does, most times it's just maybe someone is emotionally and physically drained. But again, this is a small percentage of patients that withdraw from the program.
Right. We've also had some withdrawal just because challenges within marriages is another pretty big reason why people do withdraw. And then someone has also asked that their doctor is telling them to use fresh eggs versus frozen, and why could that be? It might have to do with how confident your doctor is with warming frozen eggs. It is highly technical and it's a special skill set. We actually work with laboratories and embryologists and help them master the technique to be able to warm eggs. That's why our statistics are as good as they are. But that would be a good question to really ask your doctor why they're moving in that direction.
I have a question about my hope is to have 2 kids. Is this possible with frozen donor eggs? And I would say yes. With each egg lot, there's a 66% chance that you're going to have an excess embryo for transfer. We also are able to, if there are multiple egg lots available for that donor, you can always choose to purchase more than one and keep that on hold for future siblings.
I saw, because I do see the chat pop up, one of the questions that just came in, I think is really a great question. Do any of these plans cover the medications? So I want to just take a moment to remind you, in the donor egg treatment process, it's the donor that's doing the heavy lifting. She's the one taking all those very expensive stimulated drugs, you know, the ones that cost you between $3,000 and $5,000 per try. She's coming in for monitoring every single day. When you're the person, the recipient of the embryo, you're the woman that's having your uterus prepped, you come in only like one time for them to check your lining. And it's like pure estrogen. It's not that costly. It's under $1,000 typically for the medication. I like to think that estrogen should have street value. I've never been so happy in my life as when I was on estrogen. It was really great. And then they put you on progesterone. We recommend progesterone and oil. Neither of these need to be very expensive, and they can sometimes be covered by insurance.
So we have a patient that says, a client that says, I've decided to go with donor egg bank because I no longer have any eggs left. I will also need donor sperm. I'm 40 years old and will be seeking donor sperm. And we're happy to help you. And our sister company too, if you need to look for donor sperm, California Cryo is also a great reputable company that we work with. So we're happy to be there for you and service you.
Medical and health screening we do for the donors, is that something that is guaranteed? Well, I can guarantee you that they're screened appropriately and that we do the same process for each and every one of them, and we disqualify a whole lot. Can I guarantee you that you will never have a genetic issue? No, no one can guarantee you that. You know, we do genetic screening. We screen them for, you know, hundreds of different types of carrier types. We have the male partners tested. We take out everyone that has any type of X-linked or is predisposed to a cancer or has, you know, SMA or cystic fibrosis. But at the end of the day, de novo types of chromosomal problems happen, and there can be genetic issues. It will greatly reduce the likelihood, but it will not eliminate it.
There's a question on, is there a cutoff age for using donor egg? That is dependent on your clinic. Each clinic is a little bit different in the age that they have as far as their cutoff. So that would depend on your clinic.
Somebody asked, how many cycles does it take for a successful pregnancy? I wish we knew. If we had the answer to that, we would not need to offer the assured refund plan. The reason why we offer the assured refund plan is because if you think it'll only take you one, you're the one that takes all 6. The person that comes in thinking that they're going to need all 6 only takes one. It's human biology.
Is the donor screened for hepatitis and HIV? Yes, multiple times. All infectious disease labs, the donors go through multiple actually screenings, and they go through it at the beginning when they first come in through the clinic, and they will go through it again before retrieval. There are many regulations and guidelines that clinics have to follow for egg donation.
A donor can donate a maximum of 6 times. Those are the ASRM guidelines. And then I also saw the question pop in about psychological screening. She's given several meetings with a psychologist. She is well consented both through her physician, and then she also has to sign agreements for us as well. And she has received either the PAI or the MMPI, which are 2 diagnostic tools that the psychologist utilizes to ensure that she is a good donor of right mind. And then, Becca could also probably share, the nurses are meeting with these women. Like I said, they're coming in almost every day for monitoring. They get to know the women pretty well, and will oftentimes screen them out before they even get to that point if there's any issues.
Mm-hmm. So it looks like we've gone through most of these questions, and we're happy. If we didn't get to yours or you have specific questions, we'd love to help answer those for you. We have case managers until 9 p.m. Eastern Standard Time tonight, and we'd love to talk with you more and provide you with more information. But we're just so grateful that you joined us this evening. Was there anything else, Heidi, that you wanted to touch on?
I'm going to just tackle, as I'm still looking through the questions, let me just tackle 2 more of them. But if we didn't get to your question, by all means, call us. Somebody can answer it for you. One of the questions was, I'm in my 40s. Will that impact my success rate? Absolutely not. Your success rate is the same success rate as a woman in her 20s because you're utilizing her eggs. And another person asked, with the Assured Refund plan, the 92% take-home baby rate, is that on the very first try? Oh my gosh, if we could do it on the first try, we would be phenomenal. I think we're pretty great, but that 92% take-home baby rate is for those people that pay for the plan, persevere and stick with it. 92% of them bring a baby home from the hospital and they know and love. If for any reason you have a late-term pregnancy loss, I hate to tell you, but we've had a couple stillborn babies. We had a baby that stayed in the NICU for a while and ultimately expired. This plan covers all of that. When I was finally pregnant, I don't think I enjoyed a minute of my pregnancy because I just couldn't believe I could be successful. It couldn't work for me. And I was scared that at any point the second shoe was going to fall. So that's what this plan is all about, is peace of mind till the point you come home with a baby. But there are more questions here. We could be here all night, but we'll go ahead and sign off. But just thanking you for joining us tonight. We're happy to talk with you and answer any more questions. We hope that you find the right answer for your family, and whether that be with us or adoption or any other treatment plan. I just wish you peace and fullness and completeness in this process. Thank you.
Thank you.